My name is Cynthia Langtiw. I'm a mother. I'm the daughter of Haitian immigrants. I'm a clinical and community psychologist. And it is my firm belief that mental health is the public health issue of our time. What is most important to me is that we're not just thinking about racism as an interpersonal issue between two people, but that we're thinking about the larger structures, such as our healthcare system, our carceral system, our educational system, and how racism is embedded in those structures, and the importance of rooting out racism within the larger structures and the policies that perpetuate racism in those structures to address that as a public health issue. First of all, mental health is the public health issue of our time. If you think about any public health issue, from low birth weights to COVID-19, there is a mental health component in every single public health issue, and race plays a role in that. The other thing that I would say is that access to mental health services is not as great within traditionally marginalized communities. And so we see, right, that Black and Brown folks don't get the same kind of access to services that other folks in the United States do in particular. The other piece that I would say is that when Black and Brown folks in particular are able to access mental health services, that oftentimes the services that they receive are not meeting their intercultural and intersectional needs. I have experienced racism personally and firsthand. As the daughter of Haitian immigrants, I experienced both ethnicism with respect to being Haitian, as well as being a Black person in the United States. The other ways that I have experienced this firsthand is that I'm the mother of two Black presenting boys. I see racism as a public health crisis within my own communities. And when I say my communities, I think of myself as a Haitian immigrant, and how Haitian immigrants right now are being targeted for deportation in a way that other groups of people are not targeted. So that's one way. I think about my Asian family, right, who are afraid to walk the streets in the wake of anti-Asian sentiment that is followed up by anti-Asian violence. And so my Filipino sister-in-law and brother-in-law and my nephews and my nieces are afraid to walk the streets of Chicago and of Champaign, Illinois, because of anti-Asian sentiment. I think that we should be addressing racism as a public health issue by looking at larger systems. I think what we can do is that we can focus on individuals. We can focus on what one person has done to another. And I think that's important. But if we are going to address racism as a public health issue, we need to identify and name, right, patterns that we see. So Black men, being shot by the police, Asian people being targeted for anti-Asian sentiment, Native women 10 times more likely to be murdered, the genocide of Black trans women in the United States. All of these are public health issues that are tied to racism and ethnicism. And it's important that we look at the policies and actions that are taking at the larger systems in our education system, in our health system, in our carceral system, and that we move towards structural change to address structural racism in order to fully address this as a racism as a public health issue. We can't address racism as a public health issue without identifying the ways that structural racism plays out and the ways that it needs to be then rooted out, reimagined systems that center those that we've placed at the margins. COVID-19 has offered us a really important lens into how racism is a public health crisis. I think the fact that Latinx folks, the fact that Black folks, the fact that Native folks have been at higher risk and have died in higher numbers than other groups of folks in the United States due to COVID-19 speaks to structural racism. And the way that it speaks to structural racism is that we could predict that would be the case. And any time that any single factor can predict an outcome, it speaks to inequity. And the fact that race and COVID are related at all speak to racism embedded in our public health system. Each and every person comes with a beautiful basket of complexity, and each and every person should have their individual needs met within any healthcare system. And that's what equity means. What equity means is that the complexities that I bring to the table, right, are beautiful, but none of them should put me at more or less risk of getting the healthcare that I need for myself or for my family. I think that the work that the YWCA is doing in support of women and centering ending racism is critical as a public health issue. As Isabel Wilkerson says, racism is the stain on our democracy, and YWCA addressing that fundamental problem that drives so many structural issues that disproportionately impact women will elevate all women.